This month, we're discussing lower back pain. Sometimes lower back pain is abbreviated capital L, capital B, capital P. Today, we're going to discuss some of the ways the hip and leg muscles can pull on the skeleton and thus impact alignment. First, let's quickly review pelvic tilt. Our muscles are attached to our bones via tendons, and this is how they move our bones, right? Depending on how we position our bodies, our muscles adapt and pull our bones along with them. If we sit a lot, our hip flexors likely shorten and become tight, even though they may not be strong. Our hip flexors, which together are commonly called the iliopsoas, or separately the iliacus and psoas major, impact the tilt of the pelvis and the lower back. When they are tight, they pull the pelvis into a forward or anterior tilt, which can increase the lordotic or lumbar curve, that curve in the low back. Now, there is a natural curvature there, so we also want to be mindful of that. When the glutes are excessively tight, the opposite typically occurs, and the pelvis is tilted backwards or posteriorly. Balancing our yoga poses and our daily movements can help us avoid tilting our pelvis too far in either direction and keeping it there for too long. The plank is a good way to strengthen the core, as we talked about last week, because it also helps strengthen the surrounding muscle groups, and it can usually be incorporated into a yoga flow fairly easily. Just because one muscle group may be tighter than the other, it doesn't mean we should not activate and engage that muscle group. Often, muscles are more willing to stretch after they have contracted or at least been warmed up. That's one of the reasons a warm-up and a cool-down are an important part of every practice. Being sure we're engaging the proper muscle groups to help make up that protection the ribcage cannot offer the lumbar spine is important during every yoga practice.